Hi guys. Okay, so it is clinical ladder time for Heather Meadows, and I just want to thank you all so much for being a part of this with me and doing it this way. I know that we're doing a lot of things with video, kind of new for a lot of people, but last year I was able to do my clinical ladder teaching, my journal article teaching through videos. So you may have been part of the ones that helped me do that. And so if you're doing it again, thank you so much. So the way this works is if you would just watch this video, I will actually fill out the quiz for you. If you say, yeah, Heather, I watched your video, I'll put your name on the quiz. I forgot a true or false there, so I wrote it in. I have some editing to do to the quiz, but we'll go over that at the ending of the video. Anyway, so I'll put your name on it, and then if you will just sign the sign-in sheet that is in my box. So the sign-in sheet for this video, for this teaching, is in my box. So this is over MRSA, which is actually very relevant to what we do in our jobs every single day. And I felt like MRSA would be particularly important right now because I think that parents are going to have this heightened concern when we put their baby in contact isolation and we start taking these precautions. So I just wanted to go over, well, there's this one study that was done that I'm doing my journal article on, but also the Children's Minnesota put out some education material on MRSA, and I wanted to go over a few of the questions, kind of the bullet points that they have on that, so we can hopefully review and be prepared to put parents at ease and maybe more thoroughly answer their questions. Because I know if you're like me, I mean, we're like, yeah, I know we're not going to start your baby on antibiotic therapy. I mean, like, simmer down. We've got 3 other babies. So, I mean, sometimes it's common to us, but it's scary for a parent when you're all of a sudden putting on gowns and gloves and things like that, especially in a COVID-19 world where we're already wearing masks and they are too. So anyway, so what is MRSA and why is it so serious? This is from the Children's Minnesota. Obviously, it commonly lives on the skin and nose, and if it gets inside the body, it can cause an infection. So it's not inside the body. So we need to tell them, explain the difference between endogenous and exogenous. So endogenous would be bad, exogenous is outside the body. So it's there, but it's not an active infection inside of them. So infection versus colonization, a person can have an active infection, which means they have symptoms. So like a boil, a sore, an infected cut that's red, swollen, or pus filled. So that's active. Or they can be a carrier. And that's what we're always explaining to parents, is that their baby is like colonized. So carriers don't have symptoms that can be seen, but they still have MRSA bacteria living in their nose, skin, or gut. And if your child is a carrier, if your baby is a carrier, your healthcare provider may say that the child is colonized. So carrier and colonized are synonymous. It means the same thing. So how did my child get this? That's what they ask all the time. So the most common way to get MRSA is when a caregiver, like us, or one of the visitors, a parent is the only visitors that we have at the moment, touches the patient or objects in the patient's room without first properly washing their hands. And so I am kind of wondering now in this COVID-19 world that we're living, if we're gonna inadvertently see a decrease in the amount of MRSA cases that we have because we are so diligent to clean surfaces and washing our hands, and the visitors, the parents, are gonna be more diligent now too, because I mean, everybody's aware of COVID, so it's like, so I just wonder, because we're taking more precaution and being more intentional, and when I say we, I mean like not we as the nurses and the respiratory therapists, and I'm talking about we as the general public, as we're taking more precautions. I wonder if we're going to see less incidences of MRSA in our unit. So it's kind of curious, just a thought. to share. So will my child always have MRSA? I've actually received that question too. So some children are colonized for a month or less, and some children remain colonized with MRSA for years. So not necessarily a lifetime thing, especially when we're talking about them being a NICU baby. And then that's the end of that. So the Children's Minnesota is the one who put that out, and they put that out this year. That's copyrighted 2020. So if you guys want to look that up, or just let me know and I could shoot you an email of the article, because I saved the PDF file. I just love it when things are like simplified and we can kind of review like that. So the article that I did that I want to do the teaching over, which we're at 5 minutes now, so I'm going to try to move through it, but it's Staphylococcus aureus nasal carriage among healthcare workers, which is interesting, inpatients, our babies, and the caretakers. And this is in the Tamale Teaching Hospital in Ghana. So I know that we're talking about a bit of a different world in Ghana than it is in Tulsa, Oklahoma. But this is the article. If you guys want to look at it, be sure I could email that to you too, because digital is a beautiful thing, So in this article, I'm just going to go over the article as I did in the quiz. So some of the things that it points on, highlights to remember, is that Staphylococcus aureus is an important pathogenic bacteria. So it's not like this is bad, and we need to tell people that it serves a purpose. It's a component of the human microbiome. It resides predominantly in the anterior nares and extranasal sites, including the skin, perineum, and pharynx. So that is part of the quiz, question 1, 2, and 3 that I'll fill out for you. And those are all trues. So Staphylococcus aureus is an important pathogenic bacteria. True. It resides predominantly in the nares. True. And it resides in extranasal sites, including the skin, perineum, and pharynx. So those are all true. And then in this study, question number 5 says, how many participants were in the study? So it was kind of a small study. There were 106 participants that were part of this. And how many of the participants were neonates? There were 19. 19 of them were neonates. So again, it was a small study. But it introduces what the purpose of it was. They wanted to identify S. aureus colonized patients and healthcare workers, coupled with strict adherence to infection prevention protocols that have been proven to reduce or prevent the spread. So that's why we do contact precautions. We put on our gown, we put on our gloves. And it has been proven to reduce the spread of Staph aureus. So what is interesting about that is, like I said, with this whole COVID-19 pandemic, I'm just wondering if that's going to have a benefit in us spreading MRSA, because, you know, that's been shown. So as we're talking about, I'm going to go ahead and skip down to one of the questions. It says, let's see, do I have it on here? How many? Well, okay, let me just go ahead and go through it because I'm cautious of time. So neonates had a MRSA prevalence of 50% in this study. So of those that were swabbed, 50% of them, MRSA prevalence was among 50% of the neonates. So if a neonate is positive for Staph aureus, 50% of that would be a methicillin resistant Staph aureus. And then question 8 says approximately 1 out of every 3 S. aureus carriers harbors MRSA. So 1 out of every 3, and that's of everybody. So, and then the isolates showed highest resistance to, so the antibiotic treatment, the isolates showed highest resistance to, there were 3. I did this as a select all, amoxicillin, erythromycin, and tetracycline. So those are the 3 that it showed the highest resistance to. The antibiotic, the isolates showed the least resistance to were levofloxacin and gentamicin. So those are the two that showed the least resistance. So in this article, I thought that I had it highlighted on here because I highlighted and kind of made some notes as I went through it. But and I thought I made it part of my questions on my quiz, but I guess I didn't. But one of the things that kind of stood out to me is that they are saying that they should swab healthcare workers to see if they have MRSA, because that would be a way to track it. And so here in, normal everyday, we're talking about swabbing people to see if they have COVID, because some people don't even have symptoms of COVID, and then doing antibody tests to see if people have antibodies for it. And so I thought that was interesting, because I'm like, could we imagine what that would be like if people were swabbing us for MRSA? And the reason that MRSA is such a problem, as you all know, we've talked about it just sitting out in the hall, during our downtimes, is that we're exposed to so many antibiotics. So MRSA has the perfect opportunity in a healthcare environment. So nosocomial infections are predominant, MRSA is a predominant nosocomial infection. So because we are already exposed to so many of those antibiotics, and that is interesting to me that they said that. I wish I could just track it right here quickly in this article, but that was part of their suggestion, is that healthcare workers should be swabbed. So anyway, I thought it was interesting. I hope it's interesting to you all. Again, I'm trying to be sensitive to the time. I didn't want this to be more than 10 minutes because it can be hard to send digitally too when it's longer, and it's already longer because y'all know I'm a talker. So if y'all would like to talk about it more, I find it to be interesting. I would love to tell you about this article. Can definitely show you a copy of it. And I want to thank you again. Thank you for being a part of my clinical ladder, for helping me to mark that off the list for another year. I really appreciate you guys, because we help one another be successful. And so that is a blessing to me, and we can't do it alone. If anything, this season has shown us that we need each other to continue doing what we do. And so this is just another example of that. So I feel emotional. I'm just thankful for you guys, and I miss you all. So anyway, sign that sign-in sheet. I'll mark your name down for the quiz, and we're done for another year. So thanks so much. Bye.